I like the stool testing, and I think maybe you remember from the conference we had here a couple of years ago when I presented on the importance of the microbiome in cancer treatment. What's been found is that people who have a large percentage of certain bacteria in the gut actually have a better response to certain chemotherapies than people who don't. And as part of that, what we were doing starting to do in my last couple of years of practice was looking at, okay, so how do we get the right microbiome into people, either because they have significant GI issues or because they're going to be undergoing cancer treatment and we want to optimize it. So we were doing stool testing, looking at breakdowns of the specific types of bacteria. And if somebody needed something that wasn't available from a simple probiotic, and the probiotics typically contain acidophilus and bifidus, I think most of you are familiar with that, then we were looking at arranging for fecal transplants. Fecal transplant means taking stool from somebody who has the known bacteria and then implanting it into the colon of the patient that you're working with. And historically, it's been done through colonoscopy, and the gastroenterologists were doing this. But more recently, there's a company that has been making freeze-dried fecal transplants in capsule form that can be swallowed. And then these capsules don't dissolve until they get into the small intestine and the colon, and then can populate that area with the bacteria. And right now, it still looks like Bacteroides fragilis is the bacteria that seems to have the most immunotherapeutic effect in terms of getting the immune system ready to deal with treating the cancer and optimizing
What company is that?
Chris, help.
Open
Biome.
Open Biome. Is that the one out of the UK?
No, they're in the East Coast.
Okay, yeah.
So this is kind of moving slowly along, but it's moving.